Good morning. Thank you for joining CCN, Connect Care Network. This is Consumers Doctor, Dr. Bangala. Today's topic is optimism. Optimism in healthcare. In another 3 days, we will have the outcome of the elections, no matter who wins the race, who wins the White House or Congress or Senate. I believe in American consumers in general. I believe whatever the results are, they do the right thing. Coming back to being optimistic in healthcare, this is our norms in free enterprise. We base on what the outcome of the results will be. Ultimately, that will dictate what's going to happen for healthcare. As far as ACA, Affordable Care Act, so-called Obamacare, it has given an interesting input into the healthcare. So-called affordable, folks, it's a misnomer. I wish our policymakers be upfront and tell us. They said, oh, you can choose your doctor, you can choose your plan, you can choose, and your premiums will be lower. It's no longer. That is a fact. That's one of the reasons why it is failing. But even if Democrats win the race, it's not going to be the same. It is not going to be the same. What I feel, ultimately, the final outcome is going to be good for the Americans. But ACA has taught us 5 fundamentals. No matter which way we go, we need to have 5 things covered, which I already foresee is happening. ACA has taught us, number 1, guaranteed health insurance. We all agree on that. We all agree we need to have a guaranteed health insurance. Irrespective of you call it healthcare right, healthcare this, healthcare that, but it doesn't matter what it is, but you have to have a guaranteed health coverage. Like, having an auto insurance. Would you drive a car without an auto insurance? Would you have a home insurance policy without home without an insurance? The same thing. This is health is an asset, folks. We need to have the coverage. We need to have insurance. It has to be guaranteed, and it has to be tied to the ID card. As a personal responsibility, I foresee everybody will have a guaranteed health coverage, irrespective of whatever the results in the outcome of the elections will be. Number 2, it taught us is, this has been a hotly debated topic, pre-existing illness. They're making it a big issue out of it, but pre-existing illness will be covered, number 1. Irrespective of whatever the debate is going to be, pre-existing illnesses will be covered either with personalized health care. But one thing, we are not going to have a one-size-fits-all approach, which is not going to be happening. I believe in American consumers, they will not go for it. I see it. I've been in this country for too long for Americans to accept one-size-fits-all approach. It's not going to happen. What I see is it will be covered. This is the second most important thing we learned from the ACA, coverage of the pre-existing illness. And even President has indicated he will not sign anything without a clause of pre-existing illness coverage. And number 3, there's the uniform agreement among both political parties. 26, up to the age of 26, they have to be under the parental, they can share the parental insurance policy. After 26, they have to have individual policy. I think that is agreed. It's a foregone conclusion. 26 is the right age for the person to have individual coverage. And number 4, which has also been debated about, unlimited lifetime maximum. You really need to have this covered in a personalized healthcare system. We need to have this unlimited lifetime maximum coverage for any catastrophic incidents. So you need to. And number five, this is what comprehensive major medical coverage. Every time you talk to the policymakers, they say, oh, we need to have a comprehensive solution. That is such a misstatement to say comprehensive solution. In health insurance aspect of it, we have to have a comprehensive major medical coverage. No matter which way we go, I think I would like to see Americans come out ahead with individual responsibility to have employers issue a employer subsidized so-called deductible plan. What I renamed it as health disclosure with healthy pricing. I don't like this deductible, no deductible. I would say health disclosure, healthy pricing with a deductible component in it. You know what I'm saying? You can have, depending on what the employer and employee agrees upon, what the federal government dictates, they can come with 1,000, 1,500, 2,000, whatever. They can agree upon deductible. Whenever the premiums are lower, automatically the money is put aside into the personal care accounts. I would rather see a personal care accounts controlled by the employees, but with some input from the employers. So that way, employee is entitled to these accounts. So even if we put $300-400 a month, I'm sure employer contributes a lot more. But if employee is putting only $100, that $100 should go towards the personal care accounts, and the insurance should cover the whatever the major medical coverage is. So these are the 5 elements. Again, I'll repeat these 5 elements. What are those 5 elements? What we learned from the ACA, Affordable Care Act, is these 5 elements are guaranteed it will be addressed, irrespective. If you set up a personal care accounts or so-called market-based approach, number 1, guaranteed health insurance. Number 2, covering pre-existing illnesses. Number 3, 26 is the transition from parents to the individual policy. And number 4, unlimited lifetime maximum. And number 5, comprehensive major medical coverage. So individuals can pick and choose. Insurance companies have to be transparent, folks. It has to be. They have to be like home insurance and auto insurance. They advertise so heavily. Why can't we have the same more transparency in the health insurance sector? I'm sure insurance companies will realize that once you introduce the personal care accounts with deductible portion, once you have 160, 180 million people with the same policies, I'm sure the insurance companies have to be transparent, and it has to be. Consumers, big companies can decide which insurance policy, but I say individual mom and pop and small businesses can choose which insurance, and they have to be available for individuals and small businesses. And insurance companies have to earn their money. They have to be transparent. Like what we're going to have transparency in hospitals and doctors, which hospitals are mandated to disclose pricing from next year. That's going to help the consumers. And same thing, insurance companies have to be transparent. That will help the consumers in picking, choosing what insurance company is the best and where they can save money. And personal care accounts should be mandated, folks, irrespective. If if an average low income or average family wants to climb up the ladder, this is the only vehicle, folks. This is the only vehicle they can climb up the ladder and save money into the personal care accounts, so-called personalized healthcare. Personalized healthcare. The so-called health savings, I renamed it as Health Solutions Advantage. Whenever Americans, when they look at savings, again, we don't have the money to save. Forget about it. Let's rename that into Health Solutions Advantage. That will be used only for medical expenses. In the last episode, I talked about the segmentation. What is risk segmentation? Which is an important risk segmentation, which average folks don't understand that. This is where it is critical for Americans to look into it, because when Affordable Care Act, they passed it without realizing you'll be paying for everybody else. Do you know? Because when you have the premium, you're paying Tom, Dick, everybody's problems, and you're paying for it. So-called risk pool. Insurance companies base their premium on risk pooling across the broad spectrum. We need to stop that. It needs to be personalized. It doesn't need to, premium doesn't need to go up because people are obese, people are smoking, people are into drugs, people are, these are the things we need to address. That this is where personalized healthcare will come in handy. What are those risk categories? We don't need to share across broad spectrum. It has to be individualized. Catastrophic payments. Why do we have to pay for somebody else's catastrophic incident? That's not right. Why Americans have to pay somebody else's risk? That's not right. And number two, these are the four categories. It doesn't need to be pulled into the total risk pool. It has to be individualized. So number one is catastrophic payments from insurance. She needs to be individualized. And number two, at-risk pool needs to be individualized. Why pool that into a common risk pool? At-risk pool means people are smoking. They don't take care of their health. They have obesity. They have diabetes. They have hypertension. These are the risk pool which don't need to be shared across the broad spectrum. It needs to be individualized. You know why? Because 20% of the claims are from the risk pool. But once you individualize it, your premiums will go down. Because if I take care of my health, if I have a diabetes, they need to get into early intervention. If I have hypertension, they need to get into early intervention through personal care accounts. So the risk doesn't have to spread across everybody. So that's number two. At-risk pool needs to be individualized. It doesn't need to be shared in a common risk pool. And number three, which is really an important issue, is chronic illnesses. 63% of the Americans, so actually only 16% of them, folks, only 16% of the Americans have chronic illnesses. 16%. But their claims are 41%. When you put that in the pool, automatically premium goes up. It doesn't need to be shared in the common pool. It has to be individualized. People with chronic illnesses are 16%. Premium should be based, if only 16% of the population have chronic illnesses, why punish the rest of the 84% of the Americans because they don't have a chronic ailments? That needs to be individualized. And this is where certificate of guaranteed coverage, this is where the government has to help us in. If 16% have these chronic illnesses, this is where has the government needs to intervene and not to spread across the risk pool, and it needs to be proactively addressed and see how we can lower the premium people with chronic illnesses. The certificate of guaranteed coverage comes in handy. Finally, you're talking about well category. Majority of Americans fit into the well category. 63% of them are in well category, folks. They claim their claims are only 12%, which is less than 1% of the claims. Why do we need to punish the average folks who are healthy? 63%, you're punishing 63% of Americans to take care of the rest of the population. It's only less than 1% of the claims. Why do you have to put it in the common risk? It needs to be individualized. This is where the government gets involved. This is where I would like to see government intervention in coming up with a solution. If you have a health review board, they can address and individualize every American, lower the premium because they are healthy. They have only 1% of the claims. Why do you have to punish common folks if they are responsible in taking care of their health? You have to reward them, not punish them. This is what I don't get it. People don't go into the, every time you talk to this policy, we need to have a comprehensive solution. I've heard that too many times. Address the people who have these chronic illnesses. This is only 16% of the population. Address that and set up personal care accounts where they can take care of themselves. I'm pretty sure there's a way. It's a learning process, folks. Majority of the Americans are healthy. Why punish majority of the Americans when they can lower their premiums? You need to incentivize to take care of themselves, so that way we are addressing the entire population. And Americans are smart enough to take care of their own health. If the premiums are going to be lower, they will go to any extent to lower the premium, folks. I see a lot of people doing exercise, and they need to, people who are at risk, who have chronic, they need to be intervened early through telemedicine, telehealth. Technology is there to intervene. This is where we need to have a solution from the government, not the private sector. For government has to advise and see how we can intervene and lower the premiums. Having a public-private partnership with the health review board, address that, and through telehealth we can lower the premium. Even people who have chronic illnesses, the early intervention will solve a lot of problems, folks. I really believe there's a solution for healthcare. America doesn't need to spend $3.8 trillion. That's a lot of money, folks. That belongs to the consumers, you and me. They're taking our money. Even Medicare is too bureaucratic to talk about. Medicare is wasting a lot of money. Give it back, that empowerment, to the Medicare recipient. Whatever they're paying to the intermediary organization, they spend. I see the enrollment, when the enrollment time is up, I see we are bombarded with Medicare Advantage. What is this Medicare Advantage? You know what? It's a misnomer. It's a HMO, folks. It's a managed care. And Medicare is pumping into these stupid organizations to take your money and not address the problems. They're just handing over to intermediate. Why can't give the money back to me? If Medicare gives me, I get Social Security, but if Medicare gives me additional whatever $1,000, $1,200 paying to these so-called MSOs, MCOs, no matter who the high-risk providers, I will take that risk. I will lower my premium. I know how to lower my premium. I am the consumer. I am the senior. I am the AARP member. I want AARP to focus on this. AARP should say, demand that whatever the $1,200 they are paying it to the middlemen, so-called intermediary organizations. I will lower premium myself. I don't need Medicare to tell me how to handle my health. This is where we need to radically think. We need an insurance reform, even the Medicare reform. People, when every time you talk about Medicare reform, they think, oh, you're taking away the things from the poor people. No, as a matter of fact, I'm giving back to the poor people to take care of themselves. That's totally wrong. If Medicare recipients, they hardly make the Social Security is not even enough for them to live every month, not able to pay their rents, not able to feed themselves. That's not enough. Give that $1,200. I will take care of it. I will put money aside. I'll get whatever the personalized health insurance I need for a lower cost with a deductible, whatever my affordability is. And if they can't take care of themselves, that's where the government comes in, folks. That's where we need a certificate of guaranteed coverage. Give that certificate to these insurance companies. They will love to take care of you. They will love to take care of people with, they can't take care of themselves. I'm sure insurance companies will love that. I want certificate of guaranteed coverage. People who can't take care of themselves. People who are handicapped, people who are disabled, people who are in the low income. Give them the certificate. You're punishing the general public for a small segment of the population. You're punishing the entire segment, which is not right. I would like to see healthcare, even Medicare, to be reformed in consumers' favor, in Americans' favor. Give that money back to us. You don't need to put the money into these stupid intermediary organizations. They are taking and they're cutting down the services, deductibles, co-pays, denials, rejections, not covering the pre-existing illnesses. That's a bunch of bull. I want that power back to me. Give it back to me. I will take care of it. And as long as the Americans are responsible, they can take care of themselves. Don't waste money. Even the Medicare is wasting. I don't know where these numbers came from, the CPT, DRG. I don't know who came up with those ideas. Those numbers are totally baseless. They're not, they're all cooked up. They paid $35,000 for by 23 hours. The hospitals billed me for $227,000. And Medicare paid $35,000. My supplemental paid another. They made $60,000 for a 23-hour stay. How do you justify that? I can't get it. How do you justify $60,000 for a 23-hour stay for an angioplasty? You didn't even have. I could have had it done under $5,000 to $10,000. There's no way Americans would tolerate this nonsense. If you do like this channel, do subscribe, because I'm going to be talking about this heated topic, because Americans are being ripped off by the government, so-called Medicare. They're ripping us off. AARP seriously should look into this. Managed service organizations, so-called, they're trying to cut down all our services. They are penalizing the deductibles, co-pays, and we can't tolerate this surprise medical bills. This billing needs to go away. This Medicare billing, even billing has to go. Most of these private carriers, insurance carriers, follow the Medicare. Those billings have to go away, and it has to be. Government can come up with a solution where they can invest in you and me and everybody else. If a Medicare recipient gets that $1,200 and have them put aside small segment into the savings, get the insurance for the savings, whatever you need. And if for a catastrophic illness, your health personalized care account should be able to cover that. Government should come up with personal care accounts for all the Medicare, 60 to 70. Put that trillions of dollars into the Medicare recipients. We will handle it ourselves. We will save it. If we don't use it, it belongs to the seniors. That's where, Medicare is insolvent. Whatever the money that they have, the residual funds, put it into the personal care accounts of all the 60 to 70 million Medicare recipients. That's where the HSA money should come in from Medicare residual funds. Ultimately, Medicare is not going to be solvent, folks. Give that power back to the people. They deserve it. I know. So if you do like this channel, subscribe to this channel, make some comments. I'll keep talking about this. Healthcare is a passion for me. I want to have this solved. I'm very optimistic. Americans are smart. They can do it. I believe in Americans. Again, thank you for joining CCN Connect Care Network. We'll see you in the next episode.